So we're going to be talking about SANS today. SANS stands for Spaceflight Associated Neuro-Ocular Syndrome. It's called that because after long duration spaceflight on the International Space Station, 6 months or more on the station, we have seen an associated neuro-ocular syndrome that is unique to spaceflight. And the findings that we're seeing are optic disc edema in one or both eyes, but it's often asymmetric, of variable Friesen grades of disc edema, 1, 2, 3, but we really don't see 4 and 5 level Friesens. We see choroidal folds, and that produces a hyperopic shift because the eye is getting shorter, because the retina is getting closer to the front of the eye. So this hyperopic refractive shift is seen at near, and we have had cotton wool spots. MRIs and ultrasounds of patients with SANS show fluid in the sheath and a cephalid and orbital fluid shift that produces the disc edema and the choroidal folds and the secondary hyperopic shift. Ultrasound also confirms similar findings. Spinal taps have been done on these patients, which show borderline elevated opening pressures after they return to Earth from the station. So basically what is happening is there's a cephalid fluid shift. We can see that on MRI as well. The whole brain is shifting upward, as well as an orbital fluid shift, fluid in the sheath, flattening of the globe. And that's caused by the loss of the 1G terrestrial gravitational field that pulls the eye out, so everything moves up into the chest and into the head, and without the gravitational field it can't get back out. I haven't seen any patients lose any vision permanently, although there is a transient refractive error shift, and after return to Earth it goes away. There's no good terrestrial analog for this. We do have a head down tilt studies where patients are in the head down position, and that can generate the same kind of cephalid fluid shift. And there's been OCT changes and other changes that are similar to, but not quite the same as SANS, and certainly not of the same severity. And the closest analog that we have on Earth to SANS is idiopathic intracranial hypertension, which superficially shares some of the features: the optic disc edema, choroidal folds, hyperopic shift, not the cotton wool spots, obviously. But as you know, most IIH patients are obese young females, and our SANS cohort is mostly male, a few females, and definitely not obese patients. So spaceflight associated neuro-ocular syndrome, it's a new syndrome characterized by a cephalid orbital fluid shift that superficially looks like some of the features we see in IIH, optic disc edema, choroidal folds, and hyperopic shift. We really still don't know what causes it, and we're working on it. Longitudinal studies are ongoing to try and determine if we can see what the cause is and how the terrestrial G environment alters the hemodynamics and the CSF fluid dynamics of astronauts flying in preparation for exploring the asteroid belt and potentially a manned mission to Mars.